My name is Sebnem Bahadir. I'm an interpreting researcher, a practicing interpreter, both community and conference interpreter, and a senior lecturer at the Faculty for Translation Studies, Linguistics and Cultural Studies in Germersheim. I'm responsible for the specialization area interpreting in medical, social and institutional fields, in German Studienschwerpunkt Fachdolmetschen, in medizinischen, sozialen und behördlichen Einsatzbereichen, within the general MA program Translation, at the Department for Intercultural German Studies. And this MA specialization can be chosen since winter semester 2013-2014 at our faculty. And at the Department for Intercultural German Studies, this specialization consists of 2 modules, Wahlpflichtmodule in German, with 2 only practice-oriented courses, Übungen, and 3 seminars with theory and practice. The contents of the courses and the methods used in them were designed and implemented in an innovative project on interpreting pedagogy, supported by the Gutenberg Teaching Council of Mainz University. The title of the project was Interpreting Enactments, which is the title of our method, a new critical and emancipatory approach in interpreting didactics. This was between 2013 and 2015. Interpreting in general, but especially in medical and social settings, has fundamentally changed as a result of global migration. The demand for high-quality intercultural mediation in medical, social and legal lines of work within a society has grown considerably. The inadequacy of lay interpreters and semi-professional ad hoc interpreters in potentially conflict-laden situations is becoming more and more apparent both in practice and in research. I absolutely don't want to condemn and criticize the so-called natural interpreters, mostly family members, very often children of migrant families. They do such a great job most of the time, and the communication with migrants would totally fail in many countries if these persons would not act as interpreters in so many areas of life. But there are certain aspects to this social phenomenon of lay or natural interpreting that cause uneasiness. One point is that family members and any lay interpreters are not obliged to stick to any ethical rule of professional interpreting. They comply with other ethical rules like loyalty to the mother or advocacy for the compatriots. These are undoubtedly very important ethical principles. They require different attitudes and strategies and techniques of interpreting. These are valid interpreting strategies like shortening, summarizing, changing, adding, but they are not performed transparently. The problem is that the environment of the natural interpreter expects a totally different interpreting and thinks that any interpreting happens one word by word. On the other hand, expecting and demanding a compliance with the standards of professional interpreting from these natural interpreters is anyhow simply paradoxical. But it is not only the concern with distorted acts of translation which has been haunting me and others as well for quite a few years. It is rather the matter of overstretching these natural interpreting aids and emotionally as well as intellectually overloading the lay interpreters, especially the children, with this task. Community interpreting in medical, social and legal contexts for people of different cultures is, ethically speaking, and also politically speaking, a highly complex operation. Power imbalance is a vital characteristic of the communication dynamics in these situations. More conventional skills, like language skills, cultural skills, interpreting techniques, etc., still remain highly relevant for community interpreters. However, psychosocial competences are also key competences. That is, the culturally sensitive, responsible, problem-conscious and reflective, even self-reflective handling of ethically and politically charged interactions and emotional conflict-laden situations. So interpreting enactments, the method we use in our courses, is a method for teaching interpreting rooted in the needs and conditions of multilingual societies. And the special focus is on contexts and agents. I have started to develop the method many years ago during trainings for migrants as community interpreters outside the academia. I am very happy now that since October 2015, there exists a second interdisciplinary project, a successor project, again supported by the Gutenberg Teachings Council. And in this successor project, we work in a very interdisciplinary group of educators from the areas of community interpreting, medicine and pharmacy. And we have developed a unique course in which students of medicine, pharmacy and translation or community interpreting are to be trained together. The first time we will do this course is end of May. The course focuses on the enactments of interpreter-mediated communication between medical doctors and/or pharmacists and patients. The aim is to enable students from the medical areas to develop empathy and intercultural sensitivity for patients with limited German proficiency coming from different cultures. The aim for the students of translation and interpreting is to develop communication as well as interpreting strategies and techniques, and a cooperative ethical stance, enabling them to take part in the doctor-patient communication as a third party with an active role, not only as a channel. While interpreting has been traditionally studied and taught as mainly verbal, mental or intellectual activity, we focus on the body of the interpreter and the context of the interpretation with this method. The emotional, non-verbal and irrational dimensions of communication, as well as the social, cultural, political and personal factors that influence the interpreting performance, are just as important as the verbal, the linguistic factors. In addition, the self-confidency and the ethical positioning of the interpreter is also an integral part. And all these factors are foregrounded in the rehearsals and in the enactments. They are not only dealt with intellectually. Active participation of professionals from the future interpreters' lines of work, that means specialists from the social, medical and institutional areas, is fundamental for the implementation of interpreting enactments as a teaching and learning method. This ensures the close link of the enactments with the praxis outside the university. At the same time, professionals who come and work with us are sensitized for future collaboration with community interpreters, like the medical students now in our new project. At the same time, so aside from specialist participation, team teaching plays a vital role. Cooperation between students, tutors, teachers, and external professionals creates a flexible, dynamic, and empowering situation in which practice-oriented scenarios are developed, acted out, reflected upon, discussed, rehearsed, and this for a whole day. Normally, one scenario takes a whole day. So in this teaching and learning method, it is assumed that interpreters participate in interpreting situations as people with their whole body and emotions, not only just with their intellectual abilities. An interpreter is present as a body and as an individual with different levels of identity, that is, as a person with one and more cultures, with individual life stories, with different experiences, and these cannot simply be switched on and off during interpreting or before and after interpreting. Professional behavior and distancing techniques for emotional involvement can only be developed if interpreters first and foremost accept and embrace the fact that they are subjective, visible and present, and that they will become involved inevitably. The paradox of moving between proximity and distance when interpreting is the most fundamental characteristic of the interpreter's role, of the interpreter's professional role. The ambivalence and considerable unpredictability of interpreting scenarios mean that interpreter education should prepare interpreters for the unexpected and unforeseeable. Contrary to traditional approaches to interpreting education, which bring routine or routinization to the fore, students in interpreting enactments learn to stay awake and flexible for their whole lives, if possible and hopefully. So every interpreting scenario is new and different, and every interpreter is new and different. So at the very beginning of every interpreter-mediated communication situation, the interpreter is always initially a stranger, an intruder, and this interpreter has to negotiate her role and position in the dialogue originally designed for two. Community interpreters must be equipped for critical situations that could potentially put strain on them emotionally, physically, and intellectually. There are certainly no definitive solutions. To deal with this ambivalence creatively, community interpreters require the ability to self-present and reflect upon others and upon themselves. By working on various interpreter-mediated situations together and enacting them repeatedly, the students learn to deal with the different roles involved and how to place themselves in these other roles. Only through a self-reflexive and reflexive approach to themselves and others can students learn to develop empathy. In this respect, the interpreting enactments method stands for experience-based, student-centered, participant-oriented teaching and learning.